Now at 7, even as the FDA tried today to unpack the facts about Pfizer's new vaccine, the internet has lit up with misinformation spreading nearly as fast as the virus itself. A new report suggests the anti-vaccine movement is growing.
News 6 investigator Louis Bolden takes a closer look at some of the myths circulating that cause some Americans to say they will not take the COVID-19 vaccine.
As manufacturers and healthcare workers prepare to get COVID-19 vaccines to Americans, they are not only battling distribution, but also distrust about whether a vaccine created in months rather than years is safe.
I think with anything new, it's human tendency to be watchful.
Dr. Kartik Cherabudi is an infectious disease doctor with the University of Florida and has studied the science behind the vaccine, which brings us to myth number 1. COVID-19 vaccines are not safe because they were developed quickly.
I would say everything that we know indicates safety.
The Mayo Clinic agrees, pointing out the Pfizer vaccine was studied in 43,000 people and proven safe and effective.
So basically it creates immunity without having to go through the real disease.
Dr. Victor Herrera is an infectious disease specialist with Advent Health, which will be one of the first hospital systems in Florida to get the vaccine. They've also produced a blog, The Truth About Coronavirus Vaccine Myths. The blog addresses another myth making the rounds, that the vaccine will give you COVID-19. The truth, according to the Centers for Disease Control, none of the COVID-19 vaccines currently in development in the United States use the live virus that causes COVID-19.
That's a common misconception. All vaccines is possible that can produce some mild symptoms, and some people tend to associate that with actually getting the disease.
Social media has amplified misinformation, like this tweet which incorrectly claims another myth, that Pfizer's vaccine tampers with your DNA. According to the CDC, receiving an mRNA vaccine will not alter your DNA. A video making the same false claim was widely circulated on Facebook. It was tagged with a fact check that it's false.
We are very optimistic that the same way that we've seen it with other diseases, the vaccine is that first step to completely control COVID-19.
Based on information from the CDC, the Mayo Clinic, and interviews with 2 physicians, we give all of the myths mentioned not true on the Trust Index. In Orlando, getting results, I'm Louis Bolden, News 6.